I think this begs the question, why does someone feel tight? And the truth is, it can come from a lot of different reasons, as the pictures on the right here kind of imply. I mean, in the top position, we have a scenario where an athlete has actually limited shoulder flexion, even with gravity helping him out. His lats, the long head of his triceps, his inferior capsule, teres major, pec minor, thoracic spine, anything could be very, very tight, that could be restricting that. So the question is it true muscular shortness? You could say that in this athlete in the top right picture, it's probably a scenario of his lats being truly short. And we need to work to get some extensibility in that tissue and build up length over time. It could also be an issue of osseous or bony alignment. Using the example of an elbow, if someone has a bone spur on the underside of an elbow, they're going to be limited in elbow flexion, or excuse me, an elbow extension range of motion. And what we realize is that, hey, that tightness may actually be felt on the underside of the joint. So it could be a function of there being excessive bone growth, just like we would see in a hip in a femoral acetabular impingement case. But it can also come from a scenario where there's a misalignment, meaning someone maybe has an elbow surgery and they shave off too much bone and make somebody unstable. Unstable people can actually feel tight as well, just because of the lack of bony congruence at a joint. So you can get tightness for a lot of reasons. Certainly capsular issues are an issue that we see a lot with the hip in particular, but you can also see them in shoulders after surgeries, even in elbows after Tommy John surgery. Capsular extensibility is a big issue. Protective tension, I think, is another big one. And the example I use for this one that I think is the best is, look at someone whose hamstrings are chronically tight. So every elite sprinter in the world has very tight hamstrings. What we also know is they have a big anterior pelvic tilt. So when your pelvis tips forward anteriorly, you're actually lengthening your hamstrings. Your hamstrings are posterior tilters of the pelvis. So the question becomes, what are those hamstrings really doing? And what you realize is they're actually probably firing in a protective tension format, meaning the posterior tilt pull that those hamstrings are providing are the only thing that's preventing you from slipping into debilitating extension-based low back pain. And if we look at the guy on the bottom right of this screen as well, you'll notice he's got a huge downslope to his shoulder on the left side and the right side for that matter. He's also heavily downwardly rotated on that right side. So he's a guy who might have neck tightness, but in reality his upper traps are excessively lengthened. He sits in a lot of depression. So that tightness right there might be protective tension. It's his body just kind of laying down trigger points to create stability where it lacks it elsewhere. In many cases, if we taught him how to use his scapular upward rotators a little more effectively, a lot of things would kind of come around and that tightness might go away. Neural tension is another one. As we know, nerves don't like to be stretched. But a great example of this is if someone throws out a disc in their low back, you can often see radicular issues into the legs. So that tightness and feeling of tension in the lower extremity, might not be coming from the hamstrings being very tight. In fact, if you go and you try to stretch the hamstrings in someone who's got a neurological tension coming from their spine, you can make them much, much worse. So we have to figure out why people are really getting it. Previous injury. I know if we look at hamstring strains, the biggest risk factor for a hamstring strain is a previous hamstring strain. So, did we have some level of previous industry where it scarred down and the soft tissue restrictions built up over the course of time so that we got to this position of nasty tightness? I had a pec strain back in 2006 from bench pressing, and it's still an area where I need to get regular manual therapy on just to make sure that the tissues stay the way that they need to. What we do know is once you've had a little bit of an injury in an area, it never seems to be exactly the same, but we can definitely work towards getting it as close as we normally would. Protective spasm is another one. You look at someone who, again, throws out their back. They may spasm up all over their low back region. That doesn't necessarily mean that they've, in a chronic sense, lost range of motion. It just means that there's some kind of protective spasming taking place to protect them from getting to a potentially harmful position in the context of their injury. So I think the biggest one, and this feeds back to the protective tension side of things is, do we just have a lack of stiffness at adjacent joints? So, if you look at the scenario of the anterior pelvic tilt that we talked about with the hamstrings being very tight, the reason those hamstrings may be firing like crazy is because the glutes, which help to posterior tilt the pelvis, the rectus abdominis, and the rest of the anterior core that help to keep the pelvis back in a neutral alignment, maybe they're just not doing their job. So those hamstrings are really kind of your last point of reference for like I said, avoiding that debilitating low back pain. So we're going to talk about creating good stiffness because it's super important in the context of this laxity / hypermobility discussion.